We can have gynecological causes, as I was referring to the fact that pelvic organs can even contribute to the development of a generalized abdominal pain. So basically, it's sometimes quite difficult to differentiate between a pelvic pain and an abdominal pain. So the pelvic region, even a generalized infection of the pelvis, is sometimes contributing towards a generalized abdominal pain as well. The gynecological causes usually surpass an acute cause in non-pregnant patient. So if it's an acute cause, even it can be an ovarian torsion. Ovarian torsion is one of the major factors over here. It's an emergency condition, and even some of the ovarian cysts can even contribute towards a generalized pain in the abdomen as well. Then we can have a chronic cause in the non-pregnant patients. So if it's a cyst that has been long lying over there, it can even contribute towards it. Endometriosis, fibroids, they can usually be the generalized causes for the development of the gynecological pain. The pelvic region is sometimes involved, and sometimes the abdominal pain is seen in these patients. The acute cause in the pregnant patients. So obviously, if we are dealing with a patient who is pregnant as well, it can be due to multiple causes. It can be due to some of the emergency conditions as well. And sometimes it's a usual phenomena that the patient suffers from a dull pain as well. But you have to look for the emergency signs as well. The liquor has to be normal, and there has to be basically any kind of contractions. If the uterus is suffering from any kind of contractions, you have to basically rule that out as well. So all of these factors that you have to focus on have to be kept in mind, specifically in female patients when you're dealing with them. So here we have an app that can be downloaded for basically to look out for the complete lectures if you want to subscribe to it. And you can download this app and get a full access to the lectures as well.